Good afternoon, everyone. Welcome to the Careers and Fields Across Professions in Global Surgery panel. Today we will be exploring different possible careers in the global perioperative space, including active clinical practice, research, and advocacy. My name is Kate Pettorini. I am the unit nurse educator in the operating room at Emory University Hospital, which is part of the Emory healthcare system in Atlanta, Georgia. I myself have had a huge interest in perioperative global health and have participated in several surgical outreach programs myself. So I'm very excited to hear what our panelists have to say about their various career paths today. So we will start out just with our objectives. Our objectives today are to identify different types of career paths in global surgery, including education, clinical service, and research. Compare the pros and cons of different types of careers in global surgery, and describe the way in which global perioperative health will be a part of your own career paths. So I would love to introduce our panelists that we'll be hearing from today. First up, we have Dr. Omer Shed. Dr. Shed is a cardiac electrophysiologist in Gastonia, North Carolina. Dr. Shed is also the president of Promise for Haiti, which supports the 65-bed hospital beneficence in Pignon, Haiti, with 2 high-quality operating rooms and the community with 9 elementary schools and a clean water project. Next up, we'll have Dr. Mary Gullatte. Mary Gullatte is the corporate director for evidence-based practice and nursing research at Emory Healthcare in Atlanta. She is also adjunct faculty for the Nell Hogston Woodruff School of Nursing at Emory University. Dr. Gullatte holds professional memberships in Oncology Nursing Society, American Nurses Association, and Sigma Theta Tau. She is a current member of the Lance Armstrong Foundation. In 2010, she was inducted into the American Academy of Nursing and was elected to the Academy Board of Directors in October 2018 and 2020. She was honored as the Georgia March of Dimes Nurse of the Year in 2013 in the administration category and the 2020 Distinguished Nurse of the Year. Dr. Gullatte has traveled around the world working to educate oncology nurses and leaders in the conduct of nurse-led clinical research and transformational leadership. She has presented at numerous national and international conferences and as an invited speaker, representing 6 of the 7 continents. And then finally, we have Dr. Timothy Love. Dr. Love is the Assistant Program Director with the Pan-African Academy of Christian Surgeons and a board-certified general surgeon at the Soddo Christian Hospital in Soddo, Ethiopia. Originally from the United States, Dr. Love completed his undergrad training at the University of Central Florida and earned his MD from the University of Miami. He then completed residency at Emory University, during which time he took a 2-year research sabbatical to earn an MPH and work in Ethiopia as part of a Fogarty Global Health Fellowship. He worked at the Jackson Clinic in Tennessee until 2019, when he moved to Ethiopia to continue his surgical practice there. We're very excited to hear from all of these panelists and all of their diverse backgrounds. Moving forward, just to let you know how this will work, we will let each panelist give a brief background about themselves, and then we will follow that up with about 5 minutes for questions for each individual panelist. And then at the end of all of the presentations, we'll have time for question and answers for all of the panelists. I hope you guys have a lot of questions. Please feel free to ask them and learn a lot from each of our individual panelists. So we will start it off with Dr. Shed. Thank you.
Good afternoon. My name is Dr. Omer Shed. I'm an electrophysiologist doing cardiac device implantations like pacemakers and defibrillators. And I've taken my work to the country of Haiti. Wanted to take a few minutes to talk about the challenges that brings, and also look forward to more discussion about the topic after I'm done with this presentation. I began my experiences in Haiti in 1992, first going while I was in college, and enjoyed a work trip with other students where we did some physical labor, taught some English classes, and worked a bit around the hospital there that was just beginning to form. The hospital was formed in 1981 and had about 20 beds when we first went. Now it's a 65-bed facility. But what became readily evident to me was that to begin a relationship that I could make meaningful change over time would require developing relationships with the Haitians there and also investing myself significantly in a way that would require me to be there frequently. There are a lot of challenges to providing healthcare in the developing world, as you well understand. And Pignon, Haiti is no exception to that rule. This is what we call rush hour in Pignon. You better be out of the street when this traffic comes your way because they don't care. Speaking of which, trying to navigate impossible things is sometimes near impossible, but not always. You understand you have limited resources, limited economy is there. There's limited education and limited understanding of development, especially as it pertains to healthcare, and trying to understand how to bring a system into this century. Another important obstacle is understanding your own limitations and knowing what you can and cannot do when you're in a guest country. So it's always important to be cognizant of that so that you're able to be most effective in your work. One thing I always like to point out to anyone doing surgical work in Haiti, and most of the teams that we bring down, we require them to go out and visit some of the locals so that they can see where these patients are coming from and where they're going to before and after their surgery. This is the home of a Haitian, and the inside you can see the roof, the walls, a single table, a single room. Sometimes 8 or 10 people will be staying in a single place like this, and it's not a clean environment. Most of the time the floors are dirt, and when people leave the hospital, this is what you must expect if most of them will go home to. So it's important to make sure that the healing process is well underway before you send people home. We don't try to do same-day discharges in the country of Haiti. All of this can seem somewhat daunting, and there are a lot of major obstacles to overcome, but I like to always remind people of the starfish paradigm, I like to call it. Big problems and small steps. You may or may not have heard of the story of the starfish, but as the saying goes, a young man was throwing a single starfish into the ocean when there were millions of them littering the beach, and his father said, "Why are you doing that? None of these starfish will survive. It doesn't matter." And the child said to his dad, "But it matters to this one," and threw it in the ocean. And I tell you that brief story to remind you that you can let the complexity of the problems and the sheer number of problems overwhelm you, but if you approach them one at a time, one person at a time, one patient at a time, you can begin to see the progress over the time you're working in a place like Haiti. This is my first starfish, if you want to call it that. This young lady was the first pacemaker we implanted in Haiti. She had a history of cardiac surgery and complete heart block and required pacemaker implant, and we were able to service that procedure for her. In fact, I'm headed back in April to do a generator change for her as her battery has now reached depletion. I think it's important that you bring exposure to what you're doing and to your colleagues and people around you. If you want to be successful in global missions, you need to bring people so they can see what you're doing and help you do what you're doing. Two of these persons in this are direct colleagues of mine I work with every day, and continue to bring people back every time I go as a way of engaging people to help with the mission. So Haitian saying is, many hands make light work, and this is no exception to that rule. So get as many people involved as you can, even at the smallest levels, can be greatly helpful to you when you're trying to have success. And probably the most important thing you can do is share your knowledge and engage the locals. Everyone loves to learn and needs to learn, and it's important that you're a part of that process. It's important to also be cognizant of your time and how in the world do you juggle all of this? There are a lot of people to take care of. What's your perspective? How much are you willing to invest? What's getting in your way? where am I wasting my time? How could I be more effective? And how much time do I need for myself and my family? And how do I put all those things together? Those are questions you should ask yourself. My final thoughts are how to be effective. Number one, invest yourself in the people. They need you. They need to know you care about them and that you're invested in spending time with them. Give up to yourself. Forget the things that you feel like you need at home and all the things that our country tells you you need. You don't. There are a lot of things that you can give up and use your time more efficiently to help people who are in need. And invest your time as if it were your own family you're working with, because these people you're going to work with will become your family. Invest your own resources. As a physician in the United States, you can make a fair living. Invest your resources to help those around you. Invest your gifts that you've been given, your talents in the operating room, as administration. At any level, you can be helpful. And finally, just invest with love and understanding, because it takes a lot of both in order for everyone to benefit from the work you want to do. Thanks again, and I look forward to talking more.
Thank you so much for your presentation, Dr. Shedd. We appreciate all of your insights from all of the work that you've done down in Haiti. So we'll open it up to questions. And again, everyone, just make sure that you are using the chat feature to ask questions. I'm going to start with one for you. So this past year, like with everyone else, has been very difficult, but especially in Haiti, between the pandemic and the current political protests, even heating up right now with the current president refusing to step down. What are your thoughts behind deciding when and how to travel to Haiti in these circumstances, and to travel again in the future?
Sure. First, I'll just say thank you for having me. And I have slides that you probably did not get to see, but I'd be happy to share those with anybody who requests. Travel in Haiti doesn't really matter when there's conflict with the government, because that's nearly 100% of the time. So you have to navigate the waters fairly carefully. Our mission has generally always said the best thing to do is travel by air. And we ourselves have an airstrip in Pion, so we can travel from Fort Pierce, Florida, all the way to our town and sort of hopscotch over the hotbeds, which generally speaking is Port-au-Prince and Cap-Haïtien. But we do run into some issues at times where we can't get air travel, so we have to travel by ground. And we try to do that very safely. We have people actually positioned in each town that kind of keeps us up to date on what the situation is on the roads. And when a team goes to and from our facility, we actually send a group of motorcycles ahead of them about 15 minutes to make sure everything's smooth sailing down the road. So using that kind of strategy, we've been very successful and not had any difficulties over almost 20 plus years. But I will say for teams that go to Port-au-Prince and other areas, it can be a lot more dangerous. We're sort of a rural area and it's a safer place to visit. But when you're in areas with known instability, it's sometimes you just have to say no. It's better to stay safe than not. So every situation is different.
For sure. And safety is definitely a priority. We do have a question in the chat from Dr. Sharma. He said, a phenomenal and meaningful life's work. What can trainees do to prepare now to do this well in the future?
Great question, Dr. Sharma. I think a lot of my experience came from just going down and tagging along with the group. There was a surgical team in Pinon the first time I went in 1992, and it really sparked my interest in learning what to do and how to involve myself in the work as I got my training completed and moved on in life. So I think the most important thing is exposure and seeing and being around people who do this kind of work every day. It's best not to reinvent the wheel over and over. So tagging along with teams like your own and seeing how it's done is invaluable. It's hard to do this on your own without a lot of support and people that know what to do. Working in a developing country is very difficult, and there are a lot of obstacles and barriers, but they can be overcome utilizing the experience of people around you. So first and foremost, travel with people that you know. Number two, Understand third world medicine from an academic perspective. I think it's a good idea to get some background and read a bit about it. There's all kinds of literature available on things to expect, infectious diseases, and the problems you'll run into that you won't see in our own country. And lastly, number 3, I would say be willing to roll with the punches. Nothing ever goes as planned. Always be prepared to just accept that things will be different than what you thought they would be. And as long as you're easygoing about that, it'll be a success.
Great. All right, for time, I'm going to stop the questions quickly now, but there will be additional time for questions after each presentation is finished, so I'll hold some of these other questions for then. But we are going to go ahead now with Dr. Mary Gullatte's presentation, and she's going to tell you about some of the work she's done, and then we'll have a few questions for her.
Hello, my name is Mary Gullatte, and I am excited and honored to have the opportunity to present a little snapshot of my global healthcare work in cancer across the globe. So I'm titling this Transforming Cancer Care Around the Globe. I am a corporate director for nursing research and evidence-based practice at Emory Healthcare in Atlanta. So 6 of the 7 continents I've really had the opportunity to traverse over the past 12 years, all about cancer care around the world. So we've been doing everything from capacity building, leadership for nurses, patient outcomes and symptom management, patient safety and chemotherapy administration, nurse-sensitive indicators such as surgical site infections, wound and pain management for patients with cancer. Evidence-based practice, many of the nurses have been interested in, and I've been working with them on that as well. And of course, nurse-led research, which is near and dear to my heart. So of those 7 continents that I have had the pleasure and honor of learning from as much as I have given to them, I have traveled to India, and part of what I did there was visiting some of the schools of nursing, talking with the nursing students about leadership, about their trajectory, in terms of cancer care and their other ideas that they had about taking care of patients. In China, where I've spent most of my 12 years, each year I've gone back about 3 to 4 times a year, working with them throughout the different provinces on everything from looking at cancer care symptom management to rounding with some of the physicians on the wards. One of the largest hospitals that I had the opportunity to visit, which was like, wow, overwhelming to me, was a 10,000 bed hospital. I just never thought I would see the size of something like that, and so many patients. But it has been a wonderful journey and great opportunity for me to help share and help shape cancer care in China. I've also had the opportunity to work in Australia and New Zealand. As you can see, I had a chance to also do a little sightseeing while I'm there. I do take advantage of that as well. Went to the UAE, to Oman, Abu Dhabi, and Muscat, and we did a 2-week course there sponsored by the Oncology Nursing Society and 3 or 4 of my other colleagues. And I went there to host a 2-week conference on research and evidence-based practice for nurses. And of course, all in cancer care. I was in Manila, actually Makati City in the Philippines, and I was there for 2 weeks as well with nursing students and nurses from across the hospitals, particularly at Makati Med. And one of my nurse colleagues, who you see there in this picture, is from the Philippines, and she and I actually hosted and led the courses. In Bangkok, Thailand, had the opportunity to participate in the Asian Oncology Nursing Society conference that was, again, talking about what we need to do to help control and manage cancer and elevate better outcomes for patients throughout the world. In the Netherlands, as you can see, one of these pictures is of a volcano up in the top left-hand corner there. If you remember, I believe it was 2011, 2012, there was a volcanic eruption in Iceland, and we were stranded there, wink, wink. I enjoyed the extra week that we had because everything was fine in the Netherlands. The skies were clear, the air was great, and I got the chance to really do some touring and sightseeing while I was there. But we visited the different hospitals on the cancer units and worked with some of the staff. I learned a lot of things about their IT system that they're using for managing patients. Other global health destinations I had an opportunity to work with, again, all about transforming cancer care around the globe, was Prague, Frankfurt and Heidelberg in Germany, Paris, Ghana and Accra, and in West Africa. And I think that was my most challenging opportunity, because there was such poverty there that it was just something that I had never seen and never expected to see. But I was there with the nurses, as they were so dedicated and committed to working with patients with wound management, as well as some of their cancer issues. Oslo, Norway, Brussels, Belgium, Antalya, Turkey, as well as Geneva, Switzerland. So that's a quick speed date, if you will, about what I have been doing over the past 12 years and some of the areas that I have worked in. And again, I learn as much or more from those colleagues in those countries as I am able to impart on them. And it has really been a tremendous journey and an honor. And of course, COVID has put a stop to that this past year. And I really miss the travels and hope to get back to that soon. So thank you very much, and I will be around to listen for any questions. Thank you so much.
Such great work that you've done on almost every single continent, Mary. We're so excited to have you here. I have a question for you. You've worked so hard as a mentor to excuse me, to nurses all over the world, and I myself have benefited from this mentorship, which I'm very grateful for. But I'm curious to know, as you've traveled to so many different countries to work with so many different nurses, what similarities and what differences do you see in each area?
Thanks, Kate, and I'm excited to have the opportunity to speak with everyone today. The similarities, I think, has been that the nurses and the physicians and colleagues that I've worked with in all of these cancer areas have one major focus, and that is making sure that the patients are getting the best care. And many of the physicians have had the opportunity to train in the West, whether that was the US or the UK or Australia, and they have brought back some of the things that nurses are able to do that their nurses may not have been trained to do or are not allowed to do. And so the physicians are very special champions, I think, for advancing the role of the nurse in those countries.
That's excellent. And I see just such a great potential for this type of work across all types of nursing disciplines, including, your work in oncology, but perioperative nursing and ICU nursing and all different types of nursing. So such great work. What aspect of your mentorship do you think has had the biggest impact on nursing practice?
I think seeing someone who has the knowledge and skills to be able to have conversations with colleagues that are physicians. In many countries, that was not the case. And when I traveled, the physicians very much, again, because of their history and working in other countries, in the West particularly, they knew what nurses can do, and they knew the knowledge that nurses bring to the table and the difference that nurses make in outcomes of care for patients. And I think they very much would like to see that in their own countries from those nurses. And the nurses certainly embrace it and are excited about what they can do. I mean, we through the Oncology Nursing Society, we actually supported the Asian Oncology Nursing Society to become a society. And we have mentored them in that work of association leadership. And so that has been really one of the exciting things, too, that I have gleaned through my travels and working with the nurses.
That's amazing. Really kind of helping them empower themselves and each other, which is really incredible.
Yes.
Well, thanks so much. I'm going to have to stop the questions again for this chat, but again, we'll have a little bit more time at the end for questions. So thank you so much, Mary. And next up, we have Dr. Timothy Love.
My pleasure.
Who's going to talk to us about his work. So thank you so much.
Hello. I'd like to add my warm welcome to all of you who've decided to attend this Emory Perioperative Symposium. My name is Tim Love, and I think I have just a couple minutes to introduce myself and kind of the work that I'm involved in, and then I'm happy to answer any questions that you may have. So I'm a general surgeon trained in the final stages of my training there at Emory, and then spent 3 years in private practice doing general laparoscopic vascular trauma surgery in America. And then about 2 years ago, I moved with my family, my wife and 3 children, to Ethiopia. We live in Soddo, Ethiopia, where I am a general surgeon, which I guess we can talk about in a second. It's a little bit more general than it was in America. And I'm also the assistant program director for a fully accredited general surgery training program through what's called the Pan-African Academy of Christian Surgeons, or PACS. The hospital is Soddo Christian Hospital, and then I also hold an adjunct faculty appointment in the Emory Department of Surgery. So like I said, we moved there about 2 years ago. Interestingly, my first time in that town was about 20 years ago when I was still a pre-med student. And then over a long period of involvement in Ethiopia and preparation, we ended up moving there long-term, now heading up this surgical training program. I think that a lot of the people here on this talk are people who are considering a field in global surgery or are maybe doing it in different iterations or different themes. What we do is a very, very active, more active than I'd like sometimes, practice of general surgery. So we do what you would consider general surgery in America, but also we do a lot of urology, complex urethral strictures, and lots of prostatectomies. And unfortunately, we also do a lot of neurosurgery, all neurotrauma. I think most people who know the data about global surgery know that trauma is the primary surgical disease of the developing world, and that is undoubtedly proven to be true by my experience. For those of you who are considering doing this field, I think that the theme of mentorship has come up numerous times. It would be my encouragement that you find people in your life that you can talk to honestly about your goals and your motives and your interest. And get their feedback and get their long-term encouragement and long-term even accountability to stick with those plans. I say that because I gave up a surgeon's salary to move to Ethiopia where I don't make one. And I'll just tell you candidly that there's a lot of easier places in the world to practice. But it's what we feel called to, and it's what we feel is truly rewarding work, well beyond the reward of work RVUs or things like that. We're providing care to patients who wouldn't otherwise have any. We're providing education, which is really cutting edge for that country. We're providing a significantly higher operative volume for our trainees, and lots of character development as well. It's been a joy to be there. I don't want to keep talking. I'll happily answer any questions, but Tim Love from Ethiopia.